Good morning, everyone. Thank you so very much for joining us for this IRR media briefing on what would have been the last day of the extended lockdown. But a week is a long time in politics, and I think were lockdowns a thing in the 1960s or 70s, we might have had a different quote, because I think a lockdown is a lifetime in politics. This morning's briefing will be led by Dr. Anthea Jeffery, the head of policy research for the Institute of Race Relations, and it will be on lifting the lockdown now. How this will work, I am Herman Pretorius, the Deputy Head of Policy Research. I will be just chairing this meeting or this briefing as best as I can, as best as technology allows us. Dr. Jeffery will give her presentation, and then there will be an opportunity for questions after the presentation. Please note that there is a specific chat function, or not a chat function, excuse me, a Q&A function. So please make sure that you type your questions that you want to ask, that you want to put to Dr. Jeffery into the Q&A option. It should be visible on the little bar that appears in the middle of the screen if your mouse hovers over your screen. So without further ado, I will now hand over to Dr. Jeffery to deliver her presentation and give the context of where this presentation comes from and what it aims to achieve. Dr. Jeffery, over to you.
Thank you, Herman. As Herman said, this day is an auspicious one in the sense that we expected to be coming out of lockdown today, but we're not. And the government has a very complex proposal for us, which would see us remaining in lockdown for a very long time. And the issues are, of course, very complicated, and they need careful consideration. But we believe that there's a far better approach that would better protect the health and welfare of all South Africans, and that's what we want to talk about today. And we'll start by looking at the costs of the current lockdown and how effective it has been. If you could just move us on, Herman.
Yep.
Thank you. Sorry, technology challenges. We know that the hard lockdown is estimating costing between 13 billion to 20 billion rand. That's an enormous amount of money. And yet our economy was already on its knees before the COVID pandemic began. So these are blows that we simply cannot afford. At the same time, and most perversely, ironically, this hard lockdown is not protecting the roughly 5.5 million people who live in teeming informal settlements, nor those who live in crowded townships. In areas like that, shacks and other structures crowd closely together. Many people live in very small areas. They have to go out to share taps and toilets. They have to queue very often to do so. And social distancing simply is not possible. And we can see from the figures that the Western Cape has put out that there was a 700% increase in detected COVID-19 infections in a single week in Khayelitsha during the lockdown. So despite the lockdown restrictions, a 700% increase. And if we track that forward to 27th April, which is the most recent data that I've seen available for Khayelitsha, then the overall increase during March was 3,300%. And there are similar figures in Mitchell's Plain, a 300% increase in the first week, a 1,200% increase over the month. So a lockdown which doesn't protect all these people is really not effective enough. It's equivalent to no intervention at all for millions of South Africans, says Professor Alex van den Heever. If we could move on then to the fact that we also face the risk of many non-COVID deaths. So there are people in the EFF and perhaps more widely who criticize the opening of the economy and say what we're trying to do is put profits before lives. But the real challenge is how we can protect the lives of all South Africans and make sure that those whose lives are at risk from COVID are not being allowed, as it were, to crowd out those whose lives are at risk from other factors. We have a model in this country, an epidemiological model, which was developed at the University of Stellenbosch by Sakema, and it initially estimated that we'd have something like 87,900 to 351,000 COVID deaths. And those figures were a key reason for the government's decision to embark on a lockdown back in March. Sakema has since revised its figures. Far fewer are now expected, though it's impossible to find out exactly what it is that they are now projecting. However, according to Professor Salim Mahdi of Wits University, he thinks that we're going to have 43,000 deaths over 2 years, and he foresees 25,000 COVID deaths this year, which he says is fewer than the 28,700 deaths that we had from TB in 2017. Unfortunately, however, the hunger and the hardship from a continued lockdown could generate many additional deaths from DB, from diabetes, heart disease, cancer, and so on. The United Kingdom, for example, which is putting out more of these kinds of figures, projects as its lowest some 20,000 COVID deaths, though that figure is now, of course, outdated because the figure has risen to 26,000. But it also projected about 150,000 non-COVID ones, mostly because other diseases would tend to be ignored in the fight against COVID. So the actual figures may not be quite right, but the trend, the worry that we may have many more deaths from other causes is clear. What the government plans is a very slow and bureaucratic process. It sees the lockdown lasting to October or December 2020, or in fact, perhaps even beyond that. As I think we all know, it set out 5 risk levels ranging from 5, the hard lockdown, down to 1 where there are few restrictions. But the shift down depends solely on health issues, and solely, in fact, on COVID health issues, such as whether the spread of the disease is slowing or not, and whether the health sector is adequately prepared. No consideration is going to be given to economic harm or increased poverty and hunger. They don't enter into the calculation of whether we should shift from one level to a lower one. Officials are going to assign industries to different levels based on the transmission risks within those industries, including how many people have to travel to work within them, and the economic importance of the sector, the lockdown burden to them and the view of officials, and the contribution that they make to community well-being. Now, that last in particular is an extraordinary criterion because it doesn't seem to have any bearing on our fight against COVID, which ought to be the key factor which governs everything that the government does. And the process can be very subjective. What we have with the government is a recipe for huge centralized control, as the report in the Financial Mail put it, and criteria which are inherently subjective and are sure to be unequally applied. And this is illustrated, for example, by the decision of the Minister Ibrahim Patel, Minister of Trade and Industry, that we cannot have online shopping, even though it doesn't put people at risk, even though it's been used elsewhere, even though it helps to protect economic activity, because he sees it as offering unfair protection to sparsers and informal traders. But protecting unfair competition is not what we should be trying to do in fighting COVID. It's an irrelevant consideration. And it's quite clear that officials don't know nearly as much as each business does about its own transmission risks and how best to reduce them, which is, of course, the only valid criterion and the most important concern. Instead, the government's approach is going to generate a web of complex regulations, long delays, often while officials apply their rules to particular sectors or businesses, inconsistencies between the rules at different times and in different circumstances. And just to give one example of what officials don't know, the draft regulations that were put out earlier this week indicated that you could have 20% staff at most for many manufacturers. What if a firm needs 25% to operate? How does an official based somewhere in Pretoria know what is needed by a particular business in a different part of the country? And though that has been changed, it's been increased to 30%, it's the principle that remains. Officials don't know, and what they decide is inherently arbitrary and often unworkable. And the tragedy of it is that millions are going to remain locked out, and many businesses will still fail. There's been speculation that key metro areas could remain at level 5. That hasn't been done in the regulations we saw considered last night, but it could still happen if Nkosazana Dlamini Zuma decides, for example, that the death rates in Cape Town or Gauteng are too high. Under the present regulations, roughly 1.5 million people will be allowed to go back at level 4, but that's only a tenth of the workforce, though we do, of course, also have a number of essential workers who've also been allowed to work from the start. But most services still cannot open. Retail is still heavily restricted. We see, for example, Edcon now going into business rescue because it's lost so much money under the lockdown. We're not allowing online shopping, even though that could easily be extended far more broadly, as it has been done elsewhere, as I said before. Millions, in short, are still locked out of the economy, and that means that they could lose their homes and their jobs, exhaust their savings, go bankrupt under mountains of debt, and so on, and many more could go hungry. And there could be more looting and riots by hungry people who ironically are not protected by the lockdown in any event. And on the point of hunger, it's worth, just as an addition, to think about some of the recent polling data that's been brought out by the HSRC and by Victory Research. The HSRC poll indicates that 66% of people in formal townships don't have money for food, 55% of those in informal settlements. The Victory Research poll shows that 79% of those in informal settlements find it hard or very hard to get essentials such as food and other items. And that speaks to an enormous level of suffering, which frankly has not been taken sufficiently into account. So, what should we be doing instead? We believe that the lockdown must be lifted right now. And that 3 key principles must apply. Businesses must go back to work, but they must do also all that they can to protect their staff, customers, and any suppliers that might come to their premises, etc. The most vulnerable must retain social distancing, and if necessary, they must move into self-isolation or quarantine. And school children should return only in September, when the winter months are over. To elaborate on these 3. Businesses must go back, but protect their staff, etc. Businesses clearly know the risks in their own premises or operations, and they must reduce them. And they must do it in all the standard ways that we all know about, by screening people for fever, by maintaining sound hygiene, by keeping up social distancing, and there are various things that can be done. You can put perspex barriers between desks, arrange more space between desks or working areas. You can encourage staff to work remotely. You can perhaps have more shifts so that you reduce the number who are at work at any one time. And you could also have staggered working hours, which again would help particularly to reduce the number of people who need transport at the same time, and so would help to address that vector of risk. Trains, buses, and taxis should therefore operate at all hours, and taxis should now also be subsidized, as trains and buses have long been, to help compensate for running with fewer passengers. We know that 16.5 billion was allocated in the February budget to yet another bailout for SAA. With SAA's future now so very obscure, perhaps that money should be reallocated to help the taxis cope with this blow and make sure that they are on the roads, running when they're needed to transport people. And we can be sure that the innovation that business is capable of will be far more effective than regulation in dealing with the risks in business premises. The vulnerable must be protected. In general, we know who those are. It's elderly people, as well as those with existing medical conditions. For example, those who are HIV positive, but are not on ARVs. Those who are on ARVs seem to be okay, according to a recent study in Spain. They're no more vulnerable than anyone else. We must maintain social distancing for these people, and if anybody has been exposed to somebody with COVID or test positive for COVID, they must either be in self-isolation or in quarantine. Many of these individuals are already on social grants, but many of them also live in these overcrowded areas, in informal settlements or in overcrowded townships, and you can't just forcibly remove them. The government has been talking for weeks now about trying to thin out 29 informal settlements by moving an unspecified number of people to converted shipping containers nearby. But there's a great deal of suspicion, a great deal of resistance, and it hasn't gone beyond the consultation phase, while many experts are skeptical as to whether it can work, because people in this country are naturally so averse to anything that smacks of a forced removal. So what we could do instead is a very different thing. Encourage people who are vulnerable and can't maintain social distancing where they live to move into empty hotels and university residences and so on, with the help of tax-funded self-isolation vouchers, which would go to those institutions, which would make it possible for them to provide accommodation and food and care to those in need. School children should go back to school in September when the winter months are over, because children are likely to be silent spreaders. There's been a couple of studies which cast doubt on that, but the jury really is still out, and the great risk is that they do precisely that. They're infected, but they have zero or few symptoms, and they can pass the virus on to many. And if you think about what it means to take children back to school, you have almost 13 million people concentrated in classrooms, traveling long distances collectively by taxi, and they could easily infect their teachers and their families. In short, they could trigger an upsurge, which would then might mean a return to hard lockdown. So a better approach would be to maintain what we have now with e-learning for those who have access to the internet, and the SABC providing lessons for those who do not. We must rely on extended families, on community organizations, on jobless graduates, etc., who could be drafted in to help take care of children who are staying at home, making sure that they get through their lessons, that they have their meals, and so on. And perhaps the best way of compensating for the school meals that would no longer be provided would be to have a temporary, slightly bigger increase in the child support grant than the government is now envisaging. Just to elaborate, we heard yesterday that the government is thinking very strongly about opening schools in May. It doesn't have a firm decision to do that yet, but that seems to be its proposal. And it seems very ironic that it should want to open schools entirely at this time, but keep the economy almost entirely closed. And social isolation in the schools will be impossible. The Department of Education is urging that there should not be more than 2 pupils per desk. But those are quite small desks. It will be quite impossible to maintain social isolation in those circumstances. They talk about 40 per class, but again, there'll be no chance of having 1.5 meters between children in those circumstances. And we also know that many schools are very poorly prepared in terms of water, sanitation. About 3,500 classrooms, for example, lack access to water. And the government has simply got such a poor reputation for meeting water needs rapidly that it's hard to see how this can be resolved or how sanitation needs can be fixed in a short time. And if children do become infected without even realizing it, then the infection is going to be spread by pupils to teachers, to parents, to taxi drivers, and all these individuals in turn could spread the virus on to reopen businesses, which will then have to close. But the government seems, again, very strict that a single infection in any kind of proximity to a particular business could mean then the entire business has to close down at enormous cost. And a hard lockdown may also come back at massive cost, not just to the businesses affected, but to the entire society, and including all those millions living in informal settlements and overcrowded townships we don't even get any protection from a hard lockdown in the first place. It seems to me that it's reckless to pursue this path. UNESCO has said that globally 90% of pupils are at home in more than 180 countries. Most studies are urging school closures to cut infection flows to households and beyond. And in South Africa, we know that there are great reservations among many of the schools that feel unprepared, also among unions, parent associations, opposition parties, and all should be opposing the premature opening in May, just as the winter comes. It's just reckless to put so many children, and through the children, so many other people at risk. If we think back to what we were saying earlier about the need to open the economy while protecting the vulnerable, what we need most of all is to have a massive ramping up of testing, tracing, and treating. And to achieve that, we need business help. So if business is back in operation, business will be able to do more to help make that happen. At the moment, the rate of testing is far too slow. We're very far from the promised 36,000 tests a day by the National Health Laboratory Service. It managed to get just above 11,000 yesterday, but that's a long way from the goal that was supposed to be met by the end of May. And serological tests are also urgent. These are tests not for the virus, but for the antibodies against it. And those tests would show whether people have already been infected, have been able to fight it off, and are now much less vulnerable to it. The private sector has been crucial in this period of the lockdown in putting together the supplies that we need, particularly in terms of personal protective equipment or PPE. So some of the figures seem to me quite impressive, that with the help of the private sector, we have now 13.5 million N95 respirator masks, 31 million surgical masks for frontline health workers and patients, 200 ventilators, and 10,000 ventilators in production by private companies to be ready by June, and with the capacity to scale up to 50,000 thereafter if needed. And this massive increase in PPE and other equipment really has been made possible by private sector innovation and efficiency. And we need to bring those same strengths to bear. So in the running of public hospitals. So we would suggest that we should have public-private partnerships to really take charge of our public hospitals, to counter the inefficiency, the negligence, the waste, and the corruption that so often bedevils them. And we also need to make private hospitals into the mix. So we would suggest that there should be emergency tax-funded vouchers available for private hospitals to treat people who don't have medical scheme membership or hospital insurance. Governments say that in making their lockdown decisions, they've been following the science. Unfortunately, the scientific knowledge is still very limited, but it's important to take account of all that we do know. Modelling has often been flawed and very inaccurate, as Professor Maddy has said of the Sakima figures earlier put out, as you may recall, indicated there could be as many as 351,000 COVID deaths here, when he thinks the more likely figure is 25,000. Imperial College in London first came with a very high figure of over 500,000, revised it to 250,000, now then later said 20,000 were more likely. That has proved perhaps too optimistic because 26,000 deaths have already happened in the UK, and the college is working on a new model. As I said before, there's been little serological testing for antibodies, which is critical to know how far herd immunity might have spread. But in the US, at least, we know that influenza-like infections, or ILI, soared in March. This is because people who had slight fevers, for example, went to see their physicians, and then the data was collected and sent into a central authority. And it shows that the number of people with influenza-like infections, which could have been caused by COVID, was 23 million above an historical baseline, and that the numbers were far higher in areas with what were later known to be high COVID levels. So there did seem to be a correlation between the surge in ILI and the surge in COVID, though most of the people with ILI were never tested for COVID. But if anything like 23 million Americans have actually had the virus without knowing it, then the illness fatality rate from COVID is likely to be very much lower. Instead of looking just at the number of deaths as opposed to the number of people who've been in hospital very sick, we're looking at the number of deaths compared to a vast pool of people, the great majority of whom have had little or no symptoms. What also is interesting is that most reported COVID deaths are deaths with COVID rather than deaths from COVID. And this is obscured by the reporting methods that have been adopted for COVID, which are most unusual. Doctors in the past have never tested for flu, still wouldn't do so, so they wouldn't report it as the cause of death when other factors are present. To give an example, if somebody in the UK has cancer, but then they develop flu and bad respiratory problems, and they go into hospital and they die because of their respiratory infection, the respiratory infection would not feature at all on the death certificate. The cause of death would be the cancer, even though it was the respiratory infection that caused, in the end, the person to die. But with COVID, it's very different. It's been made a notifiable disease. So if somebody with cancer develops a respiratory infection, is found to have coronavirus, then when they die, their death is listed as a COVID death. If it had been influenza, their death would have been listed as a cancer death. So where we're reporting COVID has an impact on the number of cases that we're aware of, but not all of those COVID deaths were deaths from the virus. Many of them were deaths with the virus. And in Italy, for it asked the scientific advisor to the health minister said a number of weeks ago that at least 88% of those who had died at that time had comorbidities. Now, more recent research done at Stanford University indicates that only 0.7% of those who died were under 65 and had no underlying conditions. So many of them died with COVID rather than from COVID. An issue which has been given, I think, far too little attention to is the unconstitutionality of the continued lockdown. A state of national disaster does not suspend the Bill of Rights, unlike the state of emergency, which the government didn't try to adopt because I think it knew it wouldn't be able to do it for very long. Here, a state of emergency lasts only for 21 days. Thereafter, it has to be extended by a vote of Parliament and can last, I think, only for about 3 months. Thereafter, it needs to be again adopted by Parliament with a 60% vote. A state of national disaster can be adopted far more easily, as we've seen, but it doesn't suspend the Bill of Rights, and the government seems to be ignoring that. The lockdown, of course, infringes many of our guaranteed rights: dignity, movement. The right to administrative justice is constantly being overruled by the way in which officials are making decisions which have major impact on people and without hearing their side of the story. If we could be more confident that the lockdown was working, then perhaps we could be more comfortable with these derogations from guaranteed rights. Derogations have to meet proportionality tests, but this lockdown is not reasonably capable of protecting millions in the informal settlements, in overcrowded townships, as we've seen. And we're also quite clear that less restrictive means of guarding against COVID can indeed be found, which also casts doubt on the constitutionality of what is being done. Overall, there seems to be something profoundly irrational in the government's proposals. It seems very irrational to open the schools in May, just as we go into the winter months and the silent spreading can happen, but to keep the economy mainly closed, even though business is better able to guard employees and others against the virus. And by keeping the economy so locked down, we are adding to hunger and hardship and other disease and economic collapse. And with the schools open, the virus could unfortunately spread like wildfire in informal settlements and crowded townships where the social distancing is not possible. And even if the most vulnerable, such as grandmothers and so on, are removed, the health system will still come under great pressure. So what we believe is the right approach is to open the economy and keep the schools closed. Thank you.